Hi, I'm Dr. Tori Bodie.
And I'm Dr. Darius Moisey.
And we're here at the Flagstaff Bone and Joint Surgery Center. We appreciate you choosing us and trusting us for your partial or total knee replacement at this, our new center, which is going to offer you the safest, most cutting-edge joint replacement.
Within this video, you're next going to meet two of our physician assistants, Kirk Butler and Dave Brown, who will take you through the entire preoperative process. After that, you'll be introduced to two of our athletic trainers, Heidi and Steven, who will take you through the exercises that you will do both pre and post recovery. And then lastly, Dr. Bodie and I are going to give you a tour of our surgery center here at Flagstaff Bone and Joint.
Hi, I'm Dave Brown, physician assistant to Dr. Moisey.
And I'm Kirk Butler, physician assistant to Dr. Tori Bodie. We'll be assisting your surgeon in many aspects of your upcoming surgery and your medical care. It has been determined that you are an appropriate candidate for a total or a partial knee replacement. The most common reason for a knee replacement is osteoarthritis, which is the progressive wear and tear of the cartilage cushion of your knee.
One of our roles is to determine the appropriate preoperative testing that you'll need prior to your surgery. That will be based on your past medical history. That may include blood work, nasal swabs, an electrocardiogram. That'll all be determined at a preoperative visit in our office scheduled by our surgery scheduler. Risks of this surgery can include bleeding, infection, nerve injury, blood clot, stiffness of the knee. Our goal is to make sure that your upcoming knee surgery is as safe as possible.
A knee replacement is a surgery in which the worn-out knee is resurfaced with artificial material, damaged cartilage and bone is removed, alignment and stability is restored. There are both partial and total knee replacements. Which parts you have replaced depends on the specific pattern of arthritis. At this pre-op visit, you'll also receive a walker or crutches and a knee brace. Postoperative pain and blood thinner medication will be prescribed. If you have underlying conditions that may require additional medical clearance, this will be performed through your primary care provider or your specialist. You may also require additional imaging to help plan with your surgery, such as additional x-rays, MRI, or CT scan.
You may be instructed to stop taking certain medications the week before surgery. You will not be able to consume any food or drink by mouth after midnight the night before your surgery. Most patients will get a spinal anesthetic combined with a peripheral nerve block. That block really helps with pain that first evening. Your anesthesia provider will talk to you about your anesthetic options the day of surgery. Knee replacement surgery takes about 1 to 1.5 hours. This includes the anesthetic time as well. You'll go home about 2 to 3 hours after your surgery. You'll be able to bear weight on the surgical leg right away, but you will walk with a walker or crutches. You'll also wear a knee immobilizer while you're walking. You'll be able to remove that immobilizer to do your knee range of motion exercises. You'll also wear that immobilizer at night when you sleep. You'll start your knee exercises the morning after surgery.
First 2 weeks after surgery, focus on eating a healthy diet, staying well hydrated, and controlling knee pain and swelling. Please refrain from drugs, alcohol, and tobacco or recovering from your surgery. Outpatient physiotherapy will start approximately 3 to 5 days after surgery and lasting up to 6 weeks for partial knee replacement and up to 3 months for a total knee replacement. Goals are to restore knee range of motion, strength, stability, and normal gait or walking.
Ice and elevation are helpful for swelling. You may be given a cold therapy unit prior to surgery, or you may just simply use bags of ice or bags of frozen peas work well. It's a good idea to have a barrier between the cold and your skin, such as a towel or a washcloth. You're not to drive while you're taking your pain medications. You'll see Kirk or I back in our office for your first post-op visit about 2 weeks out from surgery. At that visit, we'll check your wound, potentially remove sutures, likely get new x-rays, and discuss any questions or concerns you may have.
6 weeks after surgery, you'll continue to exercise under the guidance of your physical therapist to build more knee strength and range of motion. Patients can start to increase their normal exercise routine, daily hobbies, or activities that you enjoy, but you still may be managing some swelling or discomfort in your knee. By 12 weeks, most patients are back to enjoying normal activity, level and function, but potentially still with some mild pain.
We'd both like to congratulate you on your upcoming partial or total knee replacement.
It's normal to be a little nervous, but also hopefully excited to have less pain and better overall function.
We'll see you very soon at the Surgery Center at Flagstaff Bone and Joint.
Hi, I'm Heidi,
And I'm Steven.
and we're athletic trainers and surgical assistants at Flagstaff Bone and Joint, working with Dr. Bodie and Dr. Moisey. Today we're going to be demonstrating 5 home exercises that you're going to be performing both before and after surgery.
Performing these exercises is vitally important to make sure you regain your knee range of motion, your strength, and your function following your knee replacement surgery. Today I will be demonstrating the exercises while Heidi instructs on how to perform them properly for you at home.
The next exercise that Steven's going to be demonstrating is knee flexion and extension from a seated position. What we're going to have you do, Steven, keeping that buttocks on the chair, back against the back of the chair, I'm going to have you bend the knee as far as you can, and right when we're done bending the knee, we're going to go into a straightened position, okay? So he's going to start off by bending the knee as far as he can until pain allows. Good. Now you're going to come back out into that extended position, bringing that leg all the way out in front of him. He's going to tighten that quad when he gets to that end range. He's going to point that toe, hold it for about 2 seconds, and you're going to relax back to that starting position. Good. Now he's going to do that a couple more times for you to demonstrate. So again, that flex position, going into that extended position. Good. One more time here. So flexion into extension. This next exercise that Steven's going to be demonstrating is countertop squats. For today's purposes, we're going to be using the windowsill. So what we're going to have you do, Steven, is place both of your hands on that windowsill, feet shoulder width apart, and what we want you to do is squat down until you start to feel discomfort. So what we want you to do is bring those hips back like you're going to be sitting in a chair, and bring your knees down. We don't want your knee to go in front of your toe for this exercise either. And then you're going to come right back up from that position. Steven's going to demonstrate 2 more of these exercises for you. Good. Make sure you're keeping your knees apart so they're not buckling in. For this exercise, it's called the straight leg raise. What you're going to be doing is laying flat on your back. The non-surgical leg is going to be bent to about a 90-degree angle, that foot flat on the ground. I want your surgical leg to be straight out in front of you. You're going to make your muscle here, so your quad muscle, so tighten that quad muscle up for me, Steven. What I want you to do is point that toe up, and I'm going to have you lift that leg about 12 inches from that table or the ground. You're going to hold that for about 3 seconds, and then you're going to slowly lower that leg back down to the starting position. Relax all your muscles, including that quad muscle, and then you're going to repeat that 20 times. So now Steven's going to demonstrate doing that exercise twice now for you. Good. Notice how he strengthens that quad muscle before he lifted that leg, slowly lowering it back down to neutral, and then back up again. Good. Back down to that starting position. And that's straight leg raises. The next exercise that we're going to be demonstrating for you is heel slides. So what we want you to do, like again, starting in that laying position or flat on your back, you're going to have your non-surgical leg and you're just going to bring it up close to that bottom. Foot flat on the ground once again. With your surgical leg, what we want you to do is starting in that extended position, so leg fully extended, what I want you to do is bring that heel. You're gonna slide that heel across that table or floor. You're gonna slide it towards your bottom as far as you can as pain allows. Once you get to that end range, what you're gonna do is slowly lower that leg back down to that starting position. Okay? You're gonna repeat that 50 times. Now Steven's going to demonstrate 2 of those exercises for you. Slowly bringing that heel towards his bottom, and then slowly lowering back down to neutral. Good.
Next, we will review how to use your crutches appropriately and safely following your knee replacement surgery. This will provide you with additional stability so you don't lose your balance when walking following your knee replacement. To use your crutches, first of all, you need to make sure your crutches are about a foot in front of you and just a little bit wider than shoulder width apart. You then put the weight through the handles of the crutches, not under the armpits, that can be a little bit uncomfortable, and then step forward with the operative knee, putting as much weight as you feel comfortably doing so, and then swing forward with the non-operative knee. Again, do this slowly, we'll just repeat this. So the crutches, foot in front of you, a little bit wider than shoulder width apart, step forward with the surgical knee, putting as much weight as you feel comfortable doing so. Come forward and then step onto the non-operative knee. So to go up the stairs safely with your crutches, I like to think of the acronym up with the good and down with the bad. So to go up the stairs, that would mean you step up with your strong leg or the non-operative leg. So step up, holding the crutches in both hands. Place the crutches down and then followed by your surgical leg. To go down the step, it's the opposite. So you go down with the bad, meaning the surgical leg. So apply the crutches first, apply the weight through the handles and step down with the operative leg, followed by your strong leg. For this section of the video, I will be demonstrating how to use your knee immobilizer brace. You'll actually wake up in this brace following your knee replacement surgery. However, this is just a quick refresher on how to both apply and remove the brace appropriately. Knee immobilizer brace is used to keep your knee straight, and it will allow protection to occur for your knee following the knee surgery. To appropriately fit your knee immobilizer brace, just make sure that your surgical knee is sitting on top of the brace. Heidi will then have to reposition the brace so the hole in front of the knee immobilizer aligns with her kneecap. Once she's done that, she's going to pull the material across to close the knee brace and begin applying the Velcro straps. I recommend starting with the strap just below the kneecap because that will provide the most stability with the knee to make sure that the brace does not move up and down when you're walking in it. Then she's just going to snugly strap up the other strap so the knee doesn't fall. If you do it too tight at the top, it tends to make the knee want to move downwards, so I suggest not putting on those straps too tightly. You'll actually wear this knee immobilizer brace for 48 hours following your knee replacement surgery, and then you'll gradually wean out of it in direction with your physical therapist. Please note, do not wear your knee immobilizer brace for longer than has been recommended by your directing physician because this can result in a loss of knee motion.
As you enter the lobby, you will first check in here at the front desk. After you register, a pre-op nurse will come out and meet you, take you back to the preoperative area where you can get changed, use the restroom if needed, have your IV placed, and back there you will meet your anesthesiologist.
Here in the pre-op area, you'll meet your nurse. Your nurse will get your IV started and then introduce you to the anesthesiologist and the nurse anesthetist. They'll talk to you about your anesthesia options, which includes a nerve block. The nerve block is usually done in the pre-op area under ultrasound guidance, and we recommend it as it helps significantly with post-operative pain. Some patients are nervous, and if you're nervous, you can also get some anti-nervous medicine as well. you can talk to your anesthesiologist about that.
After pre-op, the operating nurse will take you back to the operating room. Within the operating room, the anesthesiologist will administer either a general anesthetic or a spinal. Total surgery time is anticipated to be approximately an hour and a half.
Following surgery, you'll be brought here to the recovery room. In the recovery room, you'll usually receive a dose of antibiotics, and then your family will come and your nurse will go over the post-operative instructions, including what to do at home, how to do your exercises. We'll review crutch training and how to use the brace and ice machine. We greatly appreciate that you've chosen Flagstaff Bone and Joint for your orthopedic care.
There's been a trend nationally to perform total joint replacement in the outpatient setting. This is proven to be effective, safe, and most importantly, lower cost. At Flagstaff Bone and Joint, we're very excited to bring this level of expertise and care to Flagstaff and our surrounding communities.
We wish you a speedy recovery and are excited to get you back to the activities that you love.